Hi everyone, my name is Serena Melissa's, and today I'm going to be talking about the medicinal chemistry of NSAIDs and how enzyme inhibitors help relieve pain and inflammation. I picked this topic because NSAIDs are some of the most commonly used medications in the world. Most people have probably taken ibuprofen or aspirin before, but many people don't know how these drugs actually work. Throughout this presentation, I'll explain how NSAIDs interact with enzymes, why they're effective, some examples of common NSAIDs, and how medicinal chemists have helped improve these drugs over time. Before I get started, here's a quick overview of what I'll be covering. First, I'll explain what NSAIDs are and why they're so commonly used. Then I'll go over what causes pain and inflammation in our bodies and introduce the COX enzymes that NSAIDs target. After that, I'll explain how these drugs work and connect them back to concepts we've learned in medicinal chemistry. Then I'll talk about some common NSAIDs like ibuprofen, naproxen, aspirin, and celecoxib. I'll also discuss why side effects happen and how medicinal chemists have improved these drugs over time, and some current research. Finally, I'll finish with a few real-life applications and compare the different NSAIDs. So first, what are NSAIDs? NSAIDs stand for non-steroidal anti-inflammatory drug. These medications help reduce pain, swelling, inflammation, and fever. They are one of the most commonly used drug classes because they're available over the counter and work for many different conditions. People use NSAIDs for headaches, muscle soreness, sports injuries, arthritis, menstrual cramps, and even after dental procedures. One reason they're so popular is because they don't just cover up pain, they actually reduce inflammation, which is often the cause of the pain in the first place. Since millions of people use NSAIDs every day, they're a great example of how medicinal chemistry can improve everyday healthcare. Here are some everyday situations where people use NSAIDs. Athletes often take them after injuries like sprains or muscle strains to help reduce swelling and pain. Dentists may recommend ibuprofen after a tooth extraction because it helps with both pain and inflammation. Many people also use NSAIDs to help with menstrual cramps because prostaglandins are involved in the pain that happens during menstruation. Another major use is arthritis. People with arthritis often experience ongoing joint inflammation, so NSAIDs can help reduce stiffness and improve movement. These examples show how one class of drugs can be useful for many different conditions because they all involve inflammation. To understand how NSAIDs work, we first need to understand what causes pain and inflammation. When the body gets injured, damaged cells release substances that start with an inflammatory response. One important molecule involved is arachidonic acid. An enzyme called cycloogenase or COX converts arachidonic acid into chemicals called prostaglandins. Prostaglandins are responsible for many of the symptoms we feel after an injury. They make nerve endings more sensitive, which causes pain, and they also increase swelling by allowing more fluid to move into the injured tissues. And they can also cause fever. Without prostaglandins, the inflammatory response becomes much more smaller. That's why NSAIDs work by targeting the enzyme that makes prostaglandins instead of targeting the pain directly. So, there are actually two main COX enzymes in the body, called COX-1 and COX-2. COX-1 is always present in the body. It has important jobs like protecting the stomach lining, helping the kidneys work normally, and helping the blood clot through platelets. COX-2 is different because it's mostly produced when there's an injury or inflammation. It's mainly responsible for making prostaglandins, which is what causes pain, swelling, and inflammation. The problem that many NSAIDs block both enzymes. Blocking COX-2 helps reduce pain, But blocking COX-1 can also remove some of the stomach's natural protection, which is why NSAIDs can sometimes cause stomach irritation or ulcers. Understanding the difference between these two enzymes helps scientists design newer drugs that are way more selective. This slide shows the basic mechanism of how NSAIDs work. NSAIDs bind to the active site of COX enzyme. Once the drug is sitting in the active site, arachidonic acid can't bind, so the enzyme can't produce prostaglandins. Since fewer prostaglandins are made, pain, swelling, and inflammation all decrease. This connects directly to what we've learned in medicinal chemistry. Enzymes have active sites where molecules bind, and drugs are designed to fit in those sites. If the drug fits well, it can block the enzyme from doing its normal job. So this slide connects NSAIDs back to concepts we've learned in class. The COX enzyme is a protein, and proteins have specific three-dimensional shapes. Inside the protein is the active site, where the drug binds. The drug doesn't just stick randomly. It forms interactions with amino acids inside the active site. These can include hydrogen bonds, hydrophobic interactions, and other forces we learned about earlier in the semester. Medicinal chemists study these interactions so they can design drugs that bind better and are more selective. A better fit usually means the drug works more effectively and may cause fewer side effects. Ibuprofen is probably the NSAID that most people recognize. It is available over the counter and used for headaches, muscle pain, fever, arthritis, and many other conditions. Ibuprofen works by reversibly blocking both COX-1 and COX-2 enzymes. Because it binds reversibly, the drug eventually leaves the enzymes and normal enzyme activity returns. Ibuprofen is a good example of a small molecule drug that targets an enzyme very specifically to reduce pain and inflammation. Naproxen works very similar to ibuprofen because it also blocks the COX enzymes. One major difference is that naproxen lasts longer in the body. That means people don't have to take it as often. Because of its longer duration, it's commonly used for arthritis and long-lasting pain. Even though naproxen and ibuprofen are in the same drug class, small differences in their chemical structures affect how long they stay active in the body. Aspirin is different from many other NSAIDs because it works as an irreversible inhibitor. Instead of temporarily blocking the enzyme, aspirin permanently changes the COX enzyme by adding an acetyl group. The body has to make a new enzyme before it can work again. Because of this unique action, aspirin is also used in low doses to help prevent heart attacks and strokes. It reduces the availability of platelets to stick together and form blood clots. So aspirin has two major uses. Higher doses help reduce pain and inflammation, while low doses are commonly used to protect against cardiovascular disease. Celecoxib was developed because scientists wanted an NSAID that caused fewer stomach problems. Unlike older NSAIDs, celecoxib mainly blocks COX-2 while leaving most COX-1 actively alone. Since COX-1 helps protect the stomach lining, this usually lowers the risk of stomach ulcers and irritation. This is a great example of medicinal chemistry because scientists studied the structure of COX enzymes and designed a drug that fits better into COX-2 than COX-1. Another common NSAID is diclofenac, which is sold under brand names like Voltaren. Diclofenac works the same basic ways as the other NSAIDs by blocking the COX enzymes. This lowers the production of prostaglandins, which helps reduce pain and inflammation. One thing that makes diclofenac a little more different is that it comes in both oral tablets and topical gels. The topical gels can be rubbed directly on the painful area like a knee, ankle, or hand. This is especially helpful for people with arthritis or joint pain because the medicine is delivered right to where it's needed. Since less of the drug enters the bloodstream when it's used as a gel, there's often a lower risk of side effects like stomach irritation compared to taking NSAID pills. However, it's still important to use it as directed because side effects are still possible. Diclofenac is commonly used to treat osteoarthritis, muscle injuries, back pain, and other conditions that cause inflammation. It's another good example of how medicinal chemistry has improved drug design by creating different formulations that give patients more treatment options based on their needs. From a medicinal chemistry standpoint, diclofenac shows scientists that can improve a drug not only by changing its chemical structure, but also by changing how it's delivered to the body. In this case, a topical gel helps target the painful area while reducing some unwanted side effects. So, before a new NSAID can be sold, it goes through a long developmental process. The first step is drug design. Scientists study the COX enzyme and try to design a molecule that will fit into the enzyme's active site. Next comes chemical synthesis. Chemists make a new compound in the laboratory and confirm its structure. After that, the drug is tested in vitro. In vitro means the experiments are done outside of a living organism, usually using cells or purified enzymes. Researchers test how well the drug blocks the COX enzyme and compare it to older NSAIDs. If those results look promising, the drug moves into in vitro studies. In vivo means testing living animals. Scientists study whether the drug actually reduces pain, inflammation, and also check for side effects. If the drug is safe, it enters human clinical trials. These studies determine the correct dose, monitor side effects, and compare the new drug to existing treatments. Only after all those steps are complete can the FDA decide whether the drug should be approved. This whole process can take many years, but it's important because it can make sure new medicines are both safe and effective. So even though NSAIDs are very helpful, they can still have side effects. The biggest reason is the most NSAIDs block both COX-1 and COX-2. Blocking COX-1 reduces the stomach's protective lining, which can lead to stomach pain, ulcers, or bleeding. NSAIDs can also affect kidney function because prostaglandins help regulate blood flow to the kidneys. Some NSAIDs may slightly increase the risk of heart problems in certain patients, especially when they're taken for a long time or at a high dose. This is why doctors recommend using the lowest effective dose for the shortest amount of time. This slide shows how NSAIDs have changed over time. Scientists started with the older drugs like aspirin and then developed newer medications such as ibuprofen, naproxen, and celecoxib. Each new drug was designed to improve something, whether it was longer lasting, cause fewer stomach problems, or being more selective for COX-2. This is exactly what medicinal chemistry is about. Researchers study how drugs interact with their targets and then make changes to improve safety and effectiveness. Even today, researchers are still working on making NSAIDs better. One area of research is developing drugs that are even more selective for COX-2 to reduce stomach side effects. Scientists also study nitric oxide releasing NSAIDs. These drugs may help protect the stomach while still reducing pain and inflammation. Another area is topical NSAIDs, like gels or creams, which deliver medicine directly to the painful area instead of affecting the whole body. Finally, researchers are looking into personalized medicine. In the future, doctors may be able to choose the best NSAID for each patient based on their genetics and overall health. This research shows that medicinal chemistry is always improving drugs to make them safer and more effective. Scientists are continuing to improve NSAIDs One goal is to make drugs that only block COX-2 while avoiding COX-1 even more than current medications. Researchers are also studying nanoparticles that deliver medicine directly to inflamed tissues. This could reduce side effects because less medicine reaches healthy parts of the body. Another area is personalized medicine. In the future, doctors may choose NSAIDs based on their person's genetics or medical history, like mentioned in the previous slide. Artificial intelligence is also becoming a useful tool. AI can help scientists predict which drug structures might work best before they even make them in the lab. These new technologies show that medicinal chemistry is continuing to evolve. One real-life application of NSAIDs is treating sports injuries. Athletes and active people often deal with sprains, strains, tendon injuries, or sore muscles after exercise. When an injury happens, the body creates inflammation which leads to pain and swelling. NSAIDs help by blocking the COX enzymes, which lowers the amount of prostaglandins being made. As a result, pain and swelling go down, making it easier to move and recover. A lot of athletes use medications like ibuprofen or naproxen for a short period after an injury. These drugs don't actually cure the injury itself, but they make the symptoms much more manageable when the body recovers. It's also important not to rely on NSAIDs too much. Taking them for a long time or at high doses can increase the risk of side effects. That's why they're usually recommended for short-term pain relief, while also using rest, ice, compression, and physical therapy if needed. Another major use for NSAIDs is treating arthritis. Arthritis causes the joints to become inflamed, which leads to pain, swelling, and stiffness. This can make everyday activities like walking, climbing stairs, or even opening a jar much harder. NSAIDs help reduce pain and inflammation inside the joint, so patients usually have less of the pain and can move around more comfortably. They don't cure arthritis, but they help improve quality of life by making daily activities easier. Doctors often recommend medications like naproxen, ibuprofen, or celecoxib depending on the patient's symptoms and overall health. For people with chronic arthritis, doctors also try to balance pain relief with minimizing side effects by choosing the safest option for each patient. The following table compares 4 common NSAIDs that I talked about earlier. First is aspirin. Aspirin is unique because it permanently blocks the COX enzyme, which is why it also uses in low doses to help prevent heart attacks. Next is ibuprofen. It's one of the most commonly used NSAIDs because it's effective for many types of pain and inflammation. It's also available over the counter. Naproxen works similar to ibuprofen, but it lasts longer in the body. That means people usually don't have to take it as often. Finally, celecoxib mainly blocks COX-2 instead of both COX enzymes. Because of that, it usually causes fewer stomach problems than older NSAIDs. Even though all these medications belong to the same drug class, small differences in their structure change how they work and what they're best used for. To wrap everything up, there are a few important ideas to remember. First, NSAIDs work by targeting COX enzymes. By blocking these enzymes, they reduce the production of prostaglandins, which lowers pain, inflammation, and swelling. Second, understand enzyme structure is very important in medicinal chemistry. Scientists study the shape of enzymes and their active sites so they can design drugs that fit better and work more effectively. Finally, medicinal chemistry has helped improve NSAIDs over time. Newer drugs like celecoxib were designed to reduce some of the side effects while still providing pain relief. Overall, NSAIDs are a great example of how understanding proteins, enzymes, and drug interactions can lead to better medicines that improve people's everyday lives. These are the references I used to create my presentation. I used a course textbook along with reliable medical sources, and research articles to make sure the information was accurate and up to date. Thank you all for listening to my presentation. I hope this helped explain how NSAIDs work and how medicinal chemistry plays a huge role in designing safer and more effective medications. I appreciate your time, and I hope you learned something new about this very common class of drugs. Thank you all, and have a fantastic rest of your day. Bye-bye.